My name is Rebecca Verkest. I work as a pharmacy technician at a Walmart, and as a technician, there are some times that we encounter patients who overuse or misuse their prescription drugs. So today I'm here to talk to you about prescription drug abuse. What is an addiction? According to the Mental Health Center, an addiction is a chronic, sometimes reoccurring or relapsing brain disease, and it can affect someone's self-control. It can cause them to have a certain need to always use that drug. Prescription drug abuse is the third most common abused drug, or such as alcohol and heroin, and about 48 million people have misused their RX prescriptions. That's about 20% of the U.S. population, and a majority of those are in teenage girls from ages 12 to 17. Behaviors of an addict. Some addicts will often steal, forge, or sell their prescriptions. They try to take higher dosaging, like instead of taking one of their medication, they'll take 2 or 3. They'll have different behaviors if they're on drugs. Doctor shopping is a term that we like to use in the pharmacy. It's when a patient will go to multiple doctor's offices and get a prescription from them for hydrocodone or some other sleep medication or any other controlled substance that actually really does impact the body. And some will claim that they've misplaced their prescription or they've lost their prescriptions so that they can get a new prescription from the doctor. What does it do to the body? When you misuse prescription drugs, it can sometimes affect the brain, and you go from having a lot of brain activity to very little. And it can really damage the liver as well. I have a healthy liver right here, and an abused prescription drug liver right below. What are the most commonly abused drugs, you may ask? There are opioids, central nervous system medications, and stimulants. An opioid medication is a painkiller, of course, and there's hydrocodone, oxycodone, Demerol, and a few others. There's different strengths of the hydrocodone. There's a Norco, there's a Lortab, there's a Vicodin. And doctors have been prescribing those medications since about the 1990s. Next are the central nervous system medications. We've got some diazepam, temazepam, zolpidem, clonazepam, and a few others. And it really decreases the brain activity. It can cause a person to become much calmer and sometimes drowsy, and it's used for anxiety, seizures, and sleep disorders. According to the National Drug Institute of Drug Abuse, if you stop taking a CNS medication immediately or too overtly, it could cause some serious life-threatening effects. Stimulants. Stimulants increase the activity or alertness in the brain. You've got Ritalin, you've got Adderall, you've got Concerta, and they were initially used for obesity and for asthma, but soon they came to be used for ADD, ADHD, and narcolepsy. Treating prescription drug abuse. According to the National Institute of Drug Abuse, there are 2 different ways to help treat drug abuse. There's behavioral and pharmaceutical therapy. The behavioral, you learn strategies to deal without your medications or whichever prescription drugs it is that you may have been addicted to. You learn to deal with the cravings, avoid situations where you may be encountering those medications to make it easier for you, make you learn which areas to stay away from or who to stay away from. and counseling. Counseling can be done in groups, individually, or with the family. And then there is, like I said, using pharmaceuticals. Naltrexone is an antagonist, and it helps prevent the opioids from activating in the brain. So it kind of stops the brain from being able to get that reaction that the opioids would normally give. Vivitrol, which was originally used for alcoholism, was approved by the FDA. However, it's not very likely that a person addicted to drugs will stay on this prescription because they realize just how much it doesn't work or works too much, and they don't want it to go away. They don't want that feeling to go away. So they'll stop taking the Vivitrol and just go back to their other medications. Next is methadone. Methadone has been working very successfully for the past 40 years, and it's a synthetic opioid drug. It'll help relieve the cravings and eliminate withdrawal symptoms so that the person can better deal with the withdrawal from whichever medication it is, whether it's a stimulant and a central nervous system medication or just a regular opioid. That's all I have to say about prescription drugs. Thank you, and I hope you pass on this message.